The Evergreen Media Network Studio, powered by Scott Tree Services.
The clock.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor. Good afternoon, and welcome to Community Conversations. Every week we look around the community and say, now, if we could have a conversation with someone that is sort of off the beaten track for most, who would we think about? And so this week, we're thinking about the County Commission's Human Services and County Workforce, and a couple of different things. And so we've invited Megan Kendrick to come and talk with us about things that are going on in her world. Now, Megan, you've only been there 2 months, so I apologize. We were going to have your supervisor, but being the way life is, she got double booked, and so we really appreciate you being here. But if you don't know something, it's okay to say, not familiar, but I'll get back to you.
Thank you, Vicki. I'm really excited to be here, and I'm very excited about my new role as a Human Services Manager for Indian River County. So I'm excited to share what I know up to this point.
Well, why don't you tell us where you were before this point, and that will lend a lot of confidence to people that don't know you as well as I do.
Yeah, so I started at the school district around 2008 and was a middle school teacher. From there, I moved.
You must have been fresh out of school.
I looked like one of the students, to be truthful. After about 6 years in the classroom, I moved and I ran professional development for the school district of Indian River County, which gave me a lot of insight on anywhere from curriculum to new teacher development to how big systems work. Mm-hmm. After that, I moved over to the Freshman Learning Center where I ran the school. We had about 850 14 and 15-year-olds.
Yikes. And then you grew up fast. Your grades started to show, right?
Correct. Yeah. So, being in that setting and seeing kids struggling at 14 and 15 to even be able to read, let alone do the more complex thinking, really showed me that as a community, we needed to take a more proactive approach to getting kids reading on grade level, math, basic math skills, so that when they got to the 9th grade, they could excel in the more complex subjects. And also it allowed them the opportunity to take more electives, because when you aren't excelling, you have to take mini remediation courses.
Yes.
So it takes the ability.
It narrows their window.
Correct.
Okay.
So I moved over to the nonprofit world. I spent about 5 years there helping do fundraising and development, really looking at how do we get kids ready to be successful in the early ages. And then this opportunity opened up where I got to be directly working with agencies across our county to help build capacity within them to help be more proactive and get our kids where they need to be so they can have a successful, wonderful life and become the next taxpayers and citizens of Indian River County.
Well, you caught the message that it takes a village.
Sure.
And so in your transfer from one role to another, like most of us, you've added your understanding and your network of opportunity, I would say, to get the entire village coordinated and supporting the kids in a lot of different ways. So, when we think about the county and the county commissioners and that whole bureaucratic structure for our county, we don't often think about the kids and their education directly. Mm-hmm. Okay, that's sort of like the school district and the nonprofits. So talk to us a little bit about how you're supporting the community in ways that we might not know about.
Yeah, so it's very exciting work, first of all. I'm so honored to be able to help citizens in Indian River County. And some of the things the Human Services Department does that people don't know is that we really reach out to our citizens when they are struggling. Two of the services we offer are rent assistance and utilities assistance. This is really for families that are in a state of emergency. Let's say their car broke down or they have a health crisis and they can't make their monthly rent. If they are behind in rent or utilities, they can come into the county and we offer once a year rental assistance.
So the once a year is that each individual family can only access that once a year, not that there's a particular week where you take emergencies.
Correct.
Okay.
Yeah. So once a year, a family can come in or an individual. And if they, like I said, are late, they can submit a late notice. There is paperwork required, of course. And we will pay up to 60% of their rent, and we will pay their utility bill up to a certain point. And if anybody would like to access this kind of support, they can go onto the Human Services webpage, which is
IRC.gov?
Yes.
Okay.
IRC.gov. And they can schedule an appointment.
Okay.
While they're doing that, there will be an application that pops up and the required documents they need to bring into that appointment.
Okay. Your phone's going to be ringing off the hook tomorrow, I'm sure.
I know. And, you know, we just see.
It's been a tough year.
Yeah.
It truly has. With inflation and unemployment going down, you know, there's just, everybody says there's plenty of work to be had, but I talk to so many people that say they've put in application after application and nobody calls them back, or they get an interview and they don't get hired because they had, you know, a zillion other applicants. It's tough times.
There's definitely a great need across our county. And just to clarify, if you own a house, this does not apply. So it has to be rental, but if you apply for utilities, it can be for either a homeowner or a renter.
Okay. So if you're buying, you got to make your payments yourself. But
Yes.
if you're a rental tenant
That's where we assist.
situation, okay. Well, that's really good to know because again, many of the rents have accelerated
Correct.
in their amounts over this last year. And so people have gone through whatever savings they might have had.
And I know at the county, there's an affordable or a workforce housing committee that is looking really to help alleviate some of that through policies and different avenues. So stay tuned to hear a little more about that as well to help, you know, the citizens of Indian River County.
Well, on a regular basis, the county's also doing some things that are helping individuals.
Correct. So for any citizen in Indian River County, we offer a prescription voucher program that you can apply right online, just like the rental and utilities. But like I said, that's for everyone. And you will schedule an appointment and they will let you know what documents you need to bring in.
Okay.
So that $175 lasts the entire year.
Okay.
And you can submit different prescriptions as the year goes on until you meet that 175.
So it's like a reimbursement.
Correct.
Okay.
And then we do, if you have a family, we'll do up to $300 per year for you and your family. So that is something
That's a help.
that a lot of people don't know about that we're trying to get the word out because it can be very helpful.
Absolutely.
And in addition to that, we have a collaboration with the UP Center.
United Against Poverty.
Correct. And they have a grocery store. It is right down the street from the county offices. And we do a $10 food voucher once a month for anybody that needs those services. And I'm not sure if the community is familiar with the UP Center, but they have an affordable grocery center. So $10 at Publix might not go a long way, but $10 at UP can really help a family and they can get, you know, several dinners with that voucher.
And they have fresh produce and fresh meats and things that make it not only affordable but nutritious for your family that you might otherwise think, I can't do the fruits and vegetables because they're just too expensive.
Absolutely. I went in there for my first time and I was very impressed with just the offerings they had. So if the community hasn't gone to see it, I would encourage everybody to go check it out. It's a wonderful resource for many, many people here.
Well, and I appreciate that reminder because we can't hear it often enough. I do believe that United Against Poverty has a second site in the south end of the county, but I don't think they have member grocery store there. I'm not positive.
I think you're correct about that. Yes.
Okay.
But they have a variety of resources. So we work with United Against Poverty often for the services we can't provide. They have different agencies that are in UP. So if you are looking for a job or looking to learn a workforce trade, for example, those are all offered at UP. So I also encourage people that come in to us that are in need to
And
take
Treasure
a
Coast
visit.
Community Health is there as well.
Well,
not to miss that opportunity
look
to
at
say,
that. Yes,
how
it
about
sure
that?
is.
So again, if you don't have insurance, we have a sliding fee scale discount program so that we make it affordable. We turn no one away. If you don't have the means at the moment, but you're sick, come on in. We do schedule appointments there, but we also take walk-ins. So
Yeah, and Vicki, I think we just are collaborating now with Treasure Coast Community Health with the prescription program.
awesome.
So
Yep.
we should be able to,
Yep, we give them
merger
low cost,
services.
but if they can get reimbursed
right.
on top of that, that's even better because, again, that puts money back in their pockets so they can do things like buy growing children their shoes.
We can
Can you
talk
tell
about
I
that
have
for
one?
15 minutes as well.
Very good. So one of the other things that we're not going to talk about for too much because we're coming up to a station break, we're going to talk about the direct children's funding that the county is doing. And the name of that is?
That's CSAC, which some of you might have heard about, and it stands for the Children's Services Advisory Committee, which is an appointed board by the county commissioners.
Okay.
And we really look at how to help support programs in this county that are directly serving children and families.
We have a lot of wonderful nonprofits that offer programs before and after school, enrichment classes, tutoring, all kinds of different things to help extend their learning, hopefully in fun ways. But sometimes they just got to bite the bullet and memorize stuff. So that might not be fun, but a lot of great program partners. So we're going to talk a little bit more about that new process when we come back after a word from our sponsors. So
Great.
Stay with us. We'll be right back. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Now during our summer sale, you can save 10 to 50% store-wide on furniture in the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal, Four Seasons, Braxton Color, Capri, and more. Sofas, love seats, dining sets, bedroom groups, all in stock for immediate delivery. We're also the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Garden, Hollywood, and Kingsley Bait. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Come in now for our store-wide summer sale, including all pictures, lamps, and accessories half price. Don't forget to visit our outlet and sales store directly across the street and visit our website at sunshinefurniturecasual.com.
Sunshine Furniture.
Big news, Treasure Coast. Your favorite mortgage team just got even better. Introducing the same trusted faces you know and love, now with Union Home Mortgage.
Hi, this is Shannon Pohl. Hi, this is Lucy Cranker.
And these high-producing team members bring decades of experience, unwavering honesty, and hearts of gold to every home loan. And here's the best part. Same local processing, underwriting, and appraisers you rely on. Contact Union Home Mortgage.
Visit us online at shannonCpohl.com and lucycranker.com.
And welcome back to Community Conversations. If you're just joining, that's my tagline. If you're just joining, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health. And every week we have great individuals that come to us and share a little bit about where they're at, what they're doing, the kind of conversation that you'd like to have if you just had a little more time or if they had a little more time. So speaking of time, Megan Kendrick is here from the county today. We're missing her boss, if you're listening, but I suspect she's not because she's triple booked herself. So thank you for coming, Megan, as the human services portion of our county.
very happy to be here.
Yeah, well, I'm glad to hear that because you're a short-termer still, only a couple of months there.
Yeah.
But the honeymoon's almost wearing off, right? So we're happy that you're there too because you bring a boatload of experience as someone who's worked with kids as a teacher and then lots of other enrichment opportunities. Yeah. I think you call those human development opportunities, right?
Yes. I've been very blessed to have many of those.
And that is actually one of the things that you mentioned to me was what you anticipate being able to help the programs that are engaged in CSAC. So let's roll back the clock just a moment. CSAC stands for
Children's Services Advisory Committee,
which is appointed by the Board of Commissioners.
Correct.
And it's also funded through the county as well.
It sure is, yes.
Okay. And so the funding comes by different organizations, profit or nonprofits, making application?
Yeah, so the funding is actually a millage, and the Board of County Commissioners vote every year how much they would like to allocate to children's services.
Okay.
And once that number is decided, we put out what we call an RFP, so a request for funding. And local nonprofits in Indian River County or other agencies can apply for funding for their specific programs, which is exciting this year because we did a needs assessment. So we had a set of volunteer committee members that have a diverse background knowledge in children's services and community needs. And we looked at data sources from all over Indian River County.
And beyond.
And beyond to decide where are our biggest needs and our biggest opportunities for impact.
Okay.
I mean, we came with 3 focus areas. So our focus areas this year are health and well-being, success in school and life, and nurturing families and communities. All of these based out of the needs shown by the data.
I don't think anybody could argue with that. Unfortunately, that data has been pretty consistent over the last couple of years.
Yes, it has. So once we identified the needs, we put out this application based on these focus areas. And each focus areas then had specific indicators. So for example, in success in school and life, one of them is improved academics, while the other one is kindergarten readiness. So the program submitted their applications using a focus area and an indicator, and then they had to provide us with 3 outcomes, how they were going to measure those outcomes and what data they were going to use to show these programs' impact.
No warm and fuzzies in that.
Nope. This year, we wanted to make sure we were definitely looking and able to share the return on investment of each of these programs so we can also ensure that we're being good stewards of our taxpayer dollars. So they submitted an application, and we also had a scoring rubric. And so our grant subcommittee, another subcommittee, spent hundreds of hours reviewing all 56 applications and scoring them against this rubric. The agencies also had to come in and they had to present in front of the sub-grant committee. And, it was inspiring to see that this group of volunteers worked so hard and spent so many hours to really dig deep into these agencies. They looked over their financials, their applications, their board minutes. So the questions that were being asked of these agencies were in depth and thoughtful. And it really gave me a sense that the work was being done to ensure that not only do the children of Indian River County get the most impactful programs, but again, we are being the good stewards of the taxpayer dollars in addition to that. So the process, it was the first year.
That's phenomenal.
We did this process, and I feel like it really is going to help build capacity with these organizations and these programs in our community.
But as a result, I'm anticipating that you're going to tell me that not all 56 were funded, and that's where you come in terms of that development. Again, trying to assure that those folks that were not funded this year have an opportunity to become better and reapply in a different year?
Right. Yeah. So we funded 48 out of the 56 programs, but we are offering professional development because we believe that everyone can grow and continue on this journey of continual improvement. So we will be offering professional development open to our grant recipients and those who applied for the grants but didn't get it. And some of the topics we're going to cover is data-driven outcome, data decision making, really looking at how to diversify funding streams. A lot of these nonprofits have CEOs that are passionate about the work, and you can tell they love every day what they're doing, but they might not be so well comfortable. That is a good word. Thank you for that. With how to build a board or how to
raise money
and do fundraising and events. So that's going to be one of our focuses, because we know that we want organizations that are well diversified. So we're really excited about that opportunity to not only be able to help children immediately, but help strengthen these nonprofits to ensure we're getting the biggest impact we can.
And we have a lot of people who have moved to Florida from another state, have had different experiences, have been a part of other nonprofits that have done certain things that have made them successful, their organizations back home, as it were. And I would hope that if these folks are approached, they would be willing to give some of their time and talent to helping these other organizations here at home grow to help meet the need, because the need is great. And yet there's only so many special events that we can have within our town, because really we're still a small town at heart. Okay. There's only so many galas we can do and so many unique events. But how do you fund these things? So those kinds of brainstorming activities that you're anticipating are a great thing, because having experience as a nonprofit, I will say, it's not only lonely at the top, it's lonely because you're working so hard for your own organization that you don't have a lot of time for networking.
Yeah, I totally agree, which is really exciting because we are doing a community forum coming up. And so this would be a great opportunity for anybody in the community that wants to get more engaged or more informed to come join us to learn more about what is the current need, what are CSAC funded programs already addressing, and where is there an unmet or undermet need that's still there that we as a community can unite together to help solve.
So the needs assessment that CSAC did, is that available online?
It sure is. If you go to Children's Services, which is a webpage off irc.gov, we have our needs assessment. We have different reporting from our currently funded CSAC program, so you can see the impact they have, the number of children they have served. We also have success stories. So you were talking about being able to share some of the work. It brings tears to my eyes when I read these success stories from parents saying that it changed their kids' lives, that it changed their families' lives. So there's a lot of great work out there, and we'd love to share it with you.
That is so great. Now, if they wanted to volunteer, they would contact the individual organizations that are part of CSAC, correct?
Correct. And there's a list of all of those organizations along with their website. So you can find them all on our homepage, and then you can reach out to those organizations to see how you can get involved with your time.
So relative to outcomes, I'm going to put you on the spot, and you can say, I don't know, because I've just joined. But again, this is a new process. So the evaluation of this process, has there been any discussion yet about the outcomes expected in this type of process using the rubrics and all of those evaluation tools?
Well, we do. So
I'm sorry, I really put you on the spot.
This is okay. This new rubric we used, these programs won't start getting funded until October.
Okay.
So we still have time. A little time, but we do a Golden Impact Award at the end of every year where agencies we started it last year, although the outcomes weren't as rigorous as they are this year. They report back to us, and we then make a final report that shows you what the outcomes were, where the agencies got, and then we celebrate them at the end of every year.
Very nice. I'm so thrilled to hear all of this great information. Like any change, there's been community conversation about whether the changes were good or bad. But the reality is that all we can do is keep moving forward and sidestep if necessary. So thanks for sharing today.
Well, we're confident that these changes are really going to help the children and family here, and we couldn't be more excited to share that work as it comes in.
Wonderful. And thank you for listening to the very end, and we hope you have a wonderful night. And stay tuned next week, Saturday, 4:30, for another wonderful guest. Take care.